So, everybody, I want to welcome you tonight. We are so excited to have this presentation that Donna Bauchow is going to give us on microcurrent. And Donna is from the Aesthetics and Wellness Alliance. She is the CEO of that. She's been in the health and beauty industry for over 35 years. She's an educator, a therapist, and a spa consultant. The cool thing about this is she implements innovative devices into spas and wellness centers around the country. And she is been very active in presenting wellness, microcurrent, and some cool device therapies that she's going to talk about tonight. So it's my pleasure to introduce you to Donna Bauchow. And Donna, if you just wouldn't mind just taking it over, and I will be your assistant here.
Thank you, Kelly, so much for that introduction. And thank you, everybody, for joining me tonight. And we're going to learn how to rejuvenate our skin and look 10 years younger with non-invasive technology. So we're going to be talking about an FDA-approved Class 2 medical device. And let me do something here. I got to move you guys out of the way. I can see everybody and I can't see my screen. So this is my little wrinkle iron, or my little iPod of anti-aging is what I call it. It's a Class 2 approved medical device for aesthetic purposes. And tonight is basically educational. This presentation is for educational purposes only. It's not to give any kind of medical advice or diagnose or treatment. If you guys have this device or you're thinking about getting it, you have any concerns or contraindication questions, always consult with your physician. And the reason I'm saying that is because I'm going to give a lot of information on the background of microcurrent, and I use it actually therapeutically as well as cosmetically in the industry. I teach a lot of professionals. There are a lot of benefits to microcurrent. I help a lot of healthcare professionals in pain management, muscle re-education, for bone therapy, for eye health, for Bell's palsy and stroke, which is what I'm going to be talking about in a minute. So again, there's a lot of information that microcurrent, about microcurrent. It's amazing technology, and I just love it. And a little bit about the history of microcurrent. It started 200 years ago by a guy named Luigi Galvani. He discovered that the body conducts electrical currents. He was working with a frog and had metal probes, and then realized that the frog legs could jump. And that's where it all started, actually. So it was first used in medical applications in the early 1900s. It was used in the 1940s for bone healing by Japanese physicians. In the 1950s, it was used for needleless acupuncture. And then in the 1975, it was used for Bell's palsy and stroke. And I was working therapeutically for physical therapy. I was also a massage therapist. And I was teaching healthcare professionals how to use ultrasound as well as microcurrent in the treatment of Bell's palsy and strokes. When you have a stroke, you're going to lose that muscle memory. And as you can see by this picture here, this is one of the patients of one of the healthcare professionals that I taught. It was her patient. And when you have that stroke, you lose that muscle memory, and she couldn't open her eyes, she couldn't drink out of a straw. And this was 15-minute treatment 2 to 3 times a day for 2 to 3 weeks. This is an amazing recovery, because my mom, had I known what I know now, and could have helped my mom when she had it, because she still has that kind of smirk in her face and always thinks that she's making a face at me. But had I known what I know now, I might have been able to help her. So again, it's pretty amazing technology. And I also work with a lot of aesthetics and cosmetology schools, teaching about microcurrents as well as other nutrition and other aspects of health, anti-aging from the inside out. So my question is, do you go for the quick fix or the long-term results? If you're getting Restylane or you're getting Botox and fillers, actually they are complementary companions to microcurrent. Eventually you're not going to need it, because we're going to be working with a microcurrent and getting those accumulative results. It's going to keep rebuilding on the repair of the tissue as we work on it. But if you are getting Botox and Restylane, or you're an esthetician and you're a nurse and you're administering it, it is going to extend the benefits of the fillers and Botox. It's going to expend that time in between, so that they can come in less and they have more results longer. You can also work around the area that was actually injected. It takes 48 hours for the muscle nerves for the Botox to attach. But I always recommend, and a lot of the doctors I work with, we recommend 2 weeks, because if for some reason there's a contraindication, we don't want to bring it back to the microcurrent. The other thing to bring up now is also that Botox, it relaxes the muscles, and the fillers are that quick fix to fill in and diminish those lines and wrinkles, but they do not help with muscle re-education, collagen or elastin production, where microcurrent does. So the other thing I would do is I teach old school, new school. Old school, you've got these probes, all these wires, these huge machines. You can burn someone if you talk. Like I talk a lot with my hands. That would never work for me. That's why I like my little device. I also can travel with it. It's non-invasive, and it has so many other things that we can do with it. Non-invasive technologies are the wave of the future. Microcurrent mirrors our body's natural electrical current. What happens is when we have an injury, and what I say is wrinkles are basically, wounds are basically, wrinkles are basically just wounds. I was trying to get my train of thought here. And when we have our, when we squint, when we make faces, the way we sleep, we create these wrinkles, these, character lines. And we can reverse them with microcurrent. We basically can help with the cell turnover, and we can build new skin, and we get new elastin, and we get new collagen fibers. So when we're working with, when we have a regular injury or we have a wrinkle, our body's natural ability of the electrical energy goes around the injury. What we do with a microcurrent is we drive that current through the injury, through that wrinkle basically, and then it's going to repair faster. So we're working with a negative and a positive polarity, and negative anaphoresis, positive cataphoresis. The way you can think about this is the negative is your detoxification, your cleansing. Your positive is going to be more of the pumping of active ingredients. You're going to get more product benefits from whatever is being recommended or used on the skin after. Also, so you have your, it's the one side is going to be opening the pores, the positive side is going to be closing, the negative is increasing blood supply, the positive is decreasing, and then your negative is softening the debris and the toxins in the tissue. And then your cataphoresis is going to firm that tissue. So that's where you're going to start to see more results. Now, we're going to not only increase circulation, but we're going to help with that, help the body to reproduce, and the connective tissue, the elastin and the collagen for facial toning. There's a study, if you Google this, you're going to find it everywhere. Everyone that does microcurrent has this study and is aware of it. I got a little bit of a typo there. Basically, 200% is in healing benefits. And the University of Washington did a study where it showed that there's 14% collagen production with microcurrent, 48% for elastin, and 39% for blood circulation. It also increases ATP, and ATP are the currents of life. Basically, it's going to fill in the thinner parts of the skin. It's going to fill in the wrinkles, lift the sagging muscles. It's going to give that muscle memory back. It helps with DNA replication, and it's going to increase ATP synthesis by 500%. So again, if we have those wrinkles or we have an injury, whether I'm using this therapeutically or cosmetically, when we're increasing that ATP by 500%, and that current is going directly into that injury, we're going to see faster results. If we're giving someone products to use, if you're using products at home, anything you're going to do after this treatment is going to become 80% more effective. because that tissue and that regeneration process, you're going to get those benefits. They're going to drive in much faster, and you're going to see more results faster. So again, it has a lot to do with muscle re-education. When I was using microcurrent therapeutically, I would actually, if someone had an injury in their arm or their leg or wherever it was, I would have them go through the movements of what hurt. If this hurt, we're going to do that movement, and I'm going to be doing that microcurrent on that muscle to help re-educate. And this is also considered a TENS unit, although we're not. The FDA classifies it as a TENS unit, which is a neuromuscular stimulator. But we're using this for aesthetic purposes. That's what this unit is approved for, FDA approved for aesthetic purposes. Now, some of the aesthetic challenges we're dealing with are acne, dark circles, rashes, premature aging skin, rosacea, hormonal imbalances, healing, and infections. If you were to go to a spa or you work in a spa, you have some kind of a skin analysis. You can look under the skin and see where your lines and wrinkles, the damage, the tissue, and how someone, relates to their genetic age, as to what you're seeing under their skin. Also for sun damage. They can see that there's a 6% reduction of lines, wrinkles, pores, and texture after a galvanic treatment. Microcurrent treatment, but galvanic is what we used to call the device, and galvanic is a form of microcurrent. So I apologize. I'm getting the devices confused. So what we're going to do is I'm going to go off screen, and we're going to go through some contouring techniques, okay? And then I'm going to do one thing because I want to make sure that I can get back into the presentation on my next current slide. All right. Can you guys all see me well? All right, let me just get my little cheat sheet here so I don't forget to give you all the techniques that I have. Okay, so the first thing we're going to do, take my glasses off. And this is also a lymphatic technique. What we're going to do, and we're just going to kind of go in front. I'm going to show you them and you can kind of follow around, or you can take notes on this. We're going to go under the jowls. And we're going to hold behind the ear. There's a lymph node back here. And it helps to lift the jowl, but it also is going to move toxins out through the lymph node. And then we're going to go in front of the ear, which is also a lymph node. So we're going to go behind the ear, and we're going to go in front of the ear. And this is going to help with the jowls. All right. And we usually do that about 3 to 5 times, depending on your time frame. If this isn't a major concern for you, then you can just do it 2 or 3 times. If you want to work the character lines in the face, we're going to kind of come up, and then we're going to go around the eye to the forehead. Okay, this is the main area of the face. So what we'll do is we'll go up, up, up along the nose, around the eye, into the forehead. Okay, so, and we're going to do that about 3 to 5 times as well. Okay, and then you just slide that down. With this device, you don't want to press the skin. You want to go lightly, but you want to be firm in contact with the skin. On the way down, you just want to slide, but you want to stay in contact with the skin because the current will disconnect. Okay. The next thing we're going to do is we're going to also work on an angle in for the cheek, and we're going to come out. Okay. This is also a lymphatic stroke, and we're going to come in and we're going to lift out, and then I'm going to show you how to lift the cheek. So we're going to go in, and then we're going to come out to the temple, and we're going to come down. We're going to go in towards the nose, out to the temple, and we're going to come down. And that's going to be about 3 to 5 times as well. Now, the next thing we're going to do is we're going to bring blood to the eye. This is for poofy eyes, for bags, for all of that. We want to bring blood to the eye. So we're going to kind of just pump up towards the eye with the device. Okay. And here's my technique. I used to work with Madonna's makeup artists, and a lot of the celebrities may use this device. A lot of them would, use the big devices at the spas, and then they would take this when they traveled on tours and in their dressing rooms, and we would use this for Dancing with the Stars. It's an amazing device. And one of the techniques that I used, that she also used, was called my sit, pivot, lift. and it's going to really open the eye. And when I work with my eye doctors, this is a technique that we use for their eye health, and also when people can't see, we're lifting that eye up and they can see better, because the labial folds, when they come down, it's all droopy. So we're going to actually, we're pumping to bring the blood, and then we're going to do a sit, and we're just going to let the current do the work, and then we're going to pivot. You can count to 5, and then you're going to lift. And when you lift, you don't want to lift just here, because then you're going to have your eye like that way. Okay, so you want to make sure that you come back and you work that whole eye so that it really lifts. The other thing is, if you're working with a professional device, there's different probes. You want to use a smaller probe to bring that current directly into that area. Where I have a smaller probe right here. And what it does is that current gets really, really directed to the area we're trying to work. So anything that's a major focus that you really want to direct that current, and it's like thinning the nose or under the eyes or the lips, we're going to use a smaller head. Okay, the next technique that we're going to talk about is our frown lines between the eyebrows. That one, I do circular movements. Then I come out across, circle across. Again, these are scar tissue buildup from frowning and those kind of things, so that we want to break that scar tissue. We want to re-educate that muscle. We want to open that up and just pull it out. Okay, so we're circling and we're just coming across the forehead. Circle, come across, circle, come across. And you can work it as long as you want. If you want to lift the eyebrow up a little bit more, you can come under the eyebrow and just pull straight up to the forehead. Under the eyebrow, straight up to the forehead. Under the eyebrow, straight up to the forehead. And again, you just keep working it, so you're going to get that whole eye to lift and that eyebrow to lift up. Now, if you want to get more thinning, you want to thin your face out, you're going to come up with come up to the cheek, directly up, straight, under the cheekbone, up along the nose. Okay, and then you can also lift your cheek by sitting with the microcurrent under the cheekbone. So you're going to just come up and do strokes under the cheekbone. And then you can sit and hold that cheek up. Now, if you already have hollow cheeks, or if when you do that move, because everybody's skin responds differently with these strokes, you need to watch yourself in the mirror and see what strokes really work for you. And then if you see that you're getting a little bit of wrinkling going on under here when you're doing that stroke, come out on an angle. So just watch how your skin responds. Now, I've got 3 more strokes. The lip is the fun one. Well, let's save that one to last. I'm going to try to do that one for you. And then if you have the chin, you have like a lot of wrinkles down here, you can just do circular and then do the lymphatic strokes that come up along the jowls, circles, and then come underneath the jowls like we did before. So circle up in front of the ear and behind the ear. Okay. For the nose, to thin the nose, we're going to come up and out, up and out. So we're just kind of coming up and out, up and out. And you want to use a thinner head for that one to really thin the nose. So again, it's up and out, up and out. Now I'm going to do the lips. I'm going to kind of do it and show you. I'm going to be using something that has peptides in it, and then what we want to do is, trying to think here. If you have a small probe, you can do something like a popsicle. You can put the probe in between the lips and then have the person purse their lips. Like that, and just hold, okay? If you have this device, you're going to kind of kiss the head. You're just going to kind of kiss it. And that's going to kind of push those lips out. The other thing is you can shape the lips by pushing the lips up, pushing it up, pushing it up, pushing it down, and then you can just do the circles, kind of just get that blood flow going. And then you can put the little head on and do points. 1, 2, 3, 1, 2, 3. So I'm going to actually do it. I'm going to just put on the conductive gel, and then I'm going to apply peptides after. And I'm going to go ahead and turn my machine on. And then we're going to, you're my mirror. I don't have a mirror. And I'm just going to kind of go across my lips. And my hand is already wet on the back because I want to keep this plate for the contact. Okay. And I'm going to kind of just go across my lips and just get the circulation going. And then I'm going to kiss it. And just hold. And I'm going to circular, kind of get in there and just kind of get the blood flowing a little bit more. And then I'm going to push my lips up and down. And the more you do this, you start to feel the circulation, you start to feel the lips getting bigger. And you could do it for 3 to 5 minutes. You can always walk around as well, kind of get the lines around the lips and under the lips. You can work along the nose a little bit while you've got it, and then go back to the lips just to kind of keep that going and get it open up. Anyway, I think you get the idea. I just wanted to kind of show it to you. I'm starting to feel this one getting a little big. Yeah, start talking a little funny in a few minutes. Okay, so now I'm going to go back on screen and I'm going to show you some results. Oops, let me go back to share screen and back to slideshow from current slide. Okay, so this is someone that I know really well, and I did a 15-minute treatment on her. And I only did one side of her face, if you can tell. Look at how lifted, and remember I was telling you how you can lift that eye? I can lift that eye, look at the forehead, look at the cheek is pulled up, and see she's a lot more droopy on the side, even the neck. You can start to see a change right there. This is only 15 minutes on one side of her face. This is another 15-minute treatment, and you can see the difference. And then this one is a 60-day transformation. Remember I was saying how every time we do a treatment, it builds on those results. It's cumulative. So if you do one treatment, let's say you do 30 days, okay, and you stop. You're not going to go back to where you started. It's going to keep building from that point. Aging just starts again. So we can reverse those wrinkles, and the skin starts growing back, and the collagen and elastin starts to reproduce, and we stop, aging starts again. And this is a 5-month transformation, and she looks so different. I mean, look at how much more clear her skin is, how much more toned she is, how much like the wrinkles have really dissipated. And this one is someone else that me and Kelly know very well. And this is actually like amazing to me. It's 5 years, and she looks like her sister, 65 to 70. And I haven't seen her since, so she probably looks even younger. Therapeutic benefits of microcurrent. It's general metabolism, relaxes the nerves, stimulates circulation, restores muscle tone. It helps with pain, management, improves soft tissue regeneration, enhances healing. And what we're going to be talking about is it increases lymphatic flow. So your skin is the largest organ of the body. Skin renewal takes place every 28 to 60 days. The skin is constantly producing and shedding, and it's shedding the cells at a rate of 50,000 cells per minute, which is pretty remarkable. There are 3 layers of the skin: the epidermis for the protective shield, your dermis, which is your structure and your support, and your hypodermis, which is your insulation and your padding. And we're going to do a little fun thing right now. I'm going to tell you when to do it. What we're going to do, and this is so you can see where your complexion is, if it's older, younger, or you're right on target for your genetic age. You're going to grab the top of your skin. You're going to lift it, and we're going to do it for 5 seconds. And when we drop the skin, we let it go. I'm going to let you know where you are genetically with your age. So give me one moment. And I'm going to say start. Okay, start now. Go ahead and lift and hold. And then stop. and count. And if it took it 1 to 2, like if you counted 1 to 2, you're under 30 with, you know, your skin's complexion. If it's 3 to 4, I'm between 2 and 3, so I'm between 30 and about 30, maybe 44, and I'm 58. And 5 to 9 is 45 to 50. 10 to 15 is 60, and anything over that is around 70. So I'm pretty happy with where I am, but we can always have improvement, right? All right, so this is where things kind of get fun for me. Skin inflammation is like acne, psoriasis. When we see redness, when we're sick, inflammation is always the culprit, okay? Our skin tells you a story. And we can have a whole class just on face mapping because I love this part of things, but everything in our skin relates to something in our body. If we look at like our forehead, if we have redness in our skin on our forehead, we probably have a sugary diet. If we have a lot of deep lines in our forehead, we're probably doing a rich, oily diet. Puffy eyes could be a blocked colon, kidneys, it's stomach issues. Blue or yellowish in your skin can be a mineral deficiency. Jowls can indicate problems with the kidneys. Pores, open pores, are an acidic diet. Something also to think about is, you know, what I think is interesting is if someone's pregnant, you can see the placenta. There's a pink dot that you can see right there under their nose. If they have red noses, it's blood pressure, or they have like, sometimes if you're working on a client or maybe yourself, you can see a lot, like a little line in your ear, at the bottom of your ear, that's blood pressure issues. For me, I have sagging cheeks, that's stress and not breathing correctly because I talk too fast, you know, things like that. So you have like these sagging cheeks. Anyway, it's kind of something to think about. Also, where our skin is a reflection to things that are environmental to us, like, you know, staring at your screen too much, the blue light, or the, you know, pollution in the air, skin, the things that we're using on our skin, hairspray, pets, allergies, pesticides, all of those things. I have an app on my phone and it's called EWG, and you guys can put it on your phone if you want, but you can actually look at all your skincare products. You can look at everything and it will rate it for you. Just something fun. So conditions benefiting from lymphatic drainage, we're dealing with the skin. 15% of the skin issues lymphatic can help. The link between psoriasis and heart disease. The reason I have this slide in there is when we talk about inflammation, and I was talking about psoriasis and skin issues are related to inflammation. Well, there is a direct link in a lot of cases where psoriasis and heart disease. The lymphatic system and the circulatory system, cardiovascular system, they work so closely together. So psoriasis is an autoimmune condition that causes inflammation in the body. So it's not saying that everybody that has psoriasis has heart conditions, but what we're saying is when we work with the lymphatic system, we're actually helping the body do what it does naturally and gets rid of that inflammation. So it can help not only for, you know, health issues, but also for skin issues. So the way the lymphatic system works, and we're not going to go too much into detail, is the right side, the right lymphatic duct, actually kind of comes through half the body up to about the waist area. And then the thoracic duct, the left side, it works all the way down your body to right around the middle of your thigh. That's where that duct is. The ones that we're working with are going to be the clavicle. That's really where we're working with the skin, and we're draining through the clavicle, or so anything that comes in like from behind the ear and in the face comes down through the clavicle. So there are 600 to 800 lymph nodes. 1/3 are in the face and the neck. And again, you can kind of see they're in front of the ear, behind the ear, in the neck, and then the clavicle. Facial lymphatic drainage is not a typical massage. It's very light. We're pumping and draining the nodes towards the heart. It's very relaxing, and we're going to actually go through a little bit of a routine together with our hands so you can feel it and you can kind of get the techniques. And what I want everybody to do this because we're gonna go off screen, not yet, but we are gonna go off screen, and I'm gonna show you a little bit of a routine to do, and you're gonna feel the lymphatic system working. I want everybody to make a triangle like it is in the picture around your nose. And when you do this triangle, everything that's inside this triangle drains down. Everything that's outside this triangle comes down this way. Okay, so everything inside is down and everything outside comes out to the side of the, like around the jowls and into the clavicle. Now we're going to go off screen and I'm going to show you a little bit of a routine. So let me stop share and let me get out of the presentation. Come back and let me just go to the next slide so that we're there. Okay. All right, so now what I'm going to do is we want to open up and get the lymphatic system working. So the first thing we're going to do is we're going to come around the temples. We're going to just kind of do circular movements, and then we're going to come down to the clavicle, okay, very lightly. And we're going to do that like 3 times. And if we do this together, you're going to start feeling it as we get into this a little bit. You'll start getting like little chills, you'll start to feel it. Now the next one we're going to do is the forehead. We're going to come across the forehead, out towards the temple, and then down. And we're going to do that 3 times. This is usually where I start to feel sleepy and I start to feel things starting to happen. Okay. Then we're going to do that move I showed you earlier where you come up along the nose, and we're going to go around the eye to the forehead. And then we're going to come back and then down. Then we're going to go up along the nose, out around the eyes and the forehead, around the eyes, and come back down along the nose into the clavicle. And then one more time. And then we come up along the nose, around the eyes to the forehead, and then down. Okay. Now the next thing we're going to do is we're going to go around the eyes, out towards the temples, and then down. And we're going to do that 3 times. Around the eyes, out towards the temples, and down. You guys starting to feel relaxed? One more time around the eyes. And then down. Now the forehead, we're just going to kind of come up. And if you wanted to work the forehead longer, you can, but for time's sake, we're not. Now we're going to do the lips. We're going to come around the lips. And then we're going to go up and pump up around the nose. And around the lips. And then down. And you can spend more time if you want on those things. Now we're going to do the triangle. And what I usually do is I come out across the brow, like underneath the eyebrow, and I kind of push out and then come down. And I come up, push up along the eyebrows, come down. And then you can finish off and just kind of however you want, just come back down. Does everybody feel good? And then you could take your device and you can actually incorporate those movements like we just did with the machine. But I wanted you to actually feel it and kind of get the technique down. All right, so now I'm going to go back and share. Now, this is exciting to me, and I hope it's going to really be exciting to you. This was a 15-minute demonstration I did on one person's right side of her face. 15 minutes. If you look at all the dark colors in this one right here, you can see all the dark reds and then the white. This white is actually TMJ. She had TMJ and she was going to the doctors that day. And after 15 minutes of doing the treatment on one side of her face, look at how the colors have changed. The lighter, the more cooling colors have come in. This is pretty crazy. And it was just mind blowing to me when I saw that, wow, 15 minutes, we could really dissipate that inflammation just by moving that circulatory system in that lymph, letting the body do what it naturally does. And then this one is even more incredible. And a lot of my doctors are blown away with this picture. And I'll tell you why. I only did the right side of the neck. I basically did the neck and up behind the ear, like I was telling you, the jowls, like this kind of move right here and then down. That's all I did. 15 minutes, and it dissipated. If you can see, it dissipated up in the forehead. It changed both sides, and it got the face. And I only did this area right here and right here. And the doctors were like, well, how did we dissipate the forehead? Well, I'm going to show you that in a minute. They discovered a lymph node that they didn't know about in 2015. Studies came out. A lot of doctors still don't even know it's there if they didn't see the studies, but it's up in here that they actually found a lymph node. So when we're doing that work, it's still moving that lymph. It's just an interesting fact I wanted to share. Now, this is where you can see for more of the, let's say, acne and the psoriasis type things, you can see the changes. This is 1 month. Someone had really bad acne, and then a month later, look at how much clearer her skin is. Now, everybody is going to change at a different rate. 1 month for scarring, pretty amazing. I actually should have put my pictures in here, but I had a really bad dog bite. I had to go get stitches. And I have my before and afters. I can always share them with you if you like. I don't really have that scar, and that's from using the microcurrent. It really helped to heal that tissue. Just by doing my little facial, I was actually increasing that ATP and that cell turnover. This is rosacea. This is a mild case, but this is someone that was more severe, and it took 12 weeks. Again, you want to probably do a patch test, and you might want to talk with your doctor too to make sure. But this is such a low, non-invasive current that if you bring the information to the doctor, they probably will approve it. We have a lot of people that where there are contraindications, they've gotten approvals for things. Treatment protocol. Length is 45 minutes when you're doing it in a spa. The course is 12 sessions. And then you have your follow-up. It's 100 to 200 per session. Average is about 135. Results, basically, again, it's accumulative. Painless and relaxing. Now, this is the part that I think is fun. Well, not this part, from the next slide. But, we have the treatment guideline. Obviously, the younger you are, it's more preventative. The older you are, it becomes more maintenance. Contraindications. You don't ever want to use on an open sore. If there's anything that you're concerned about, you always want to talk to your physician. You don't want to apply directly on the eyes. You always want to be working in the muscles around. I can always send you more of the information on contraindications as well. Now, this is where I said it's fun. When I'm working with my healthcare professionals in my spas, they really have an advantage with the microcurrent because, when you're dealing with most of the surgeons, they're into the plastic surgery. Everybody's doing the Botox and the Restylane, your nurses. Estheticians really have a competitive edge because this is a non-surgical facelift, and you can see by those pictures and how fast the results are. And your products become so much more effective. If you know how long it takes for that product to work and then you do microcurrent, you're going to see it much faster. And then if you're doing a more advanced treatment with somebody, then they're coming to you for all the contouring and all the for the major stuff, and then they're just going home and using it to drive those products in, and they're going to see faster results. We can do lunchtime facials, twilight facials. I used to do a lot of twilight facials. We'd have wine, and we would do makeup, and we'd have reflexology, and it was a lot of fun. We can do it's great for post-surgical facelifts, maintaining benefits, again, for the Botox. It's going to extend the treatment out with Botox and fillers. It's a complement and an asset to medical practice. It's cost-effective equipment. The other thing is, if you work with a professional or you have a license or you partner with someone that is licensed, they can bill out medically for medical equipment as well as the treatment. It's also a new spa segment and revenue stream. So I want to thank you for coming. I wanted to let you know about the next class. And then if you want to stay on for questions, or you have a device and you want to know how to use it a little bit more, everyone has a different device. That's why we're not doing it on the actual training. I'm going to be doing a class on the 6th, same time as today, at 6 p.m. Pacific Standard Time. It's on a device that actually stimulates a gene in your skin for collagen production. It helps to exfoliate and it helps to extract at the same time. It's non-invasive, and it will talk to you and your clients. It will tell them if they've missed a spot, if they need to work longer on an area. It will follow their progress and show before and afters, and your products are going to become more effective. So it's an amazing technology, and in conjunction with this, it's I can't even imagine where it's going to go. I'm excited. Anyway, thank you, thank you, thank you. And again, if you want to stay on, we're just going to give it a few minutes, and then we'll get into any questions and things like that. Kelly?
Thank you so much, Donna. We are just anxious to hear what you have to say next week. We'll all look forward to that. And I will stop the recording, and you can stay on and give us some of the tips and tricks we need to run that.